Mark and Min.
Yo, that's me.
I'm Mike Zayden, lovely to meet you. Oh, what happened? Did you injure yourself?
We'll talk inside.
Yeah, no worries. That's right. Keep it confidential.
Yeah, true.
So, Mark, how can I help you today?
I've got like weakness in this foot.
Yeah.
It's pretty bad, and I get some numbness, cramping, all this stuff.
Okay.
It's annoying.
How long has this swelling been there for?
4-6 weeks around then.
Yeah. Okay.
Oh, it's just annoying me, like with work, and it's getting hard. So I'm like, no. And it's starting to get big as well. It wasn't that big. Very surprised. Look at my other leg.
Yeah, I've noticed. I am comparing both sides. Have you changed anything since last time, such as your diet by any chance?
Yeah, I just started eating more fish, chicken, all this sort of stuff.
Okay.
Just like normal human beings.
Okay. Those foods are high in iodine. Is it okay if I have a look at your leg, just to assess what's happening underneath?
Just don't pull my pants too much up. I hate it.
That's fine.
If you do it,
That's
you
fine.
get it.
I'll just have a peek underneath. Okay, so I'm noticing there's a bit of hyperpigmentation, so discoloration, hyperkeratotic lesion, so hard skin. It also seems a bit waxy. Seems fine on this side. And there's a lot of swelling, and if I push down, it's like, I'm very sorry, but it also looks like it pits as well.
Yeah, it does.
Alright, so what I'm going to do now is I'm going to do further tests, but I just want to tell you from what I can see for now, based on your diet and your symptoms as well, your numbness and pain, I would just like to say that so far from what I'm thinking, it could be hypothyroidism, but have you seen your GP or anything like that?
Nah.
Yeah?
I thought podiatrist. I love podiatrist. Come to you.
Look, we don't have the answers for everything. We work in a multidisciplinary team, so we'll probably, after all this, I'll try and confirm as much as I can. If it is hypothyroidism, then I'll send you off to a referral.
That's why I'm here.
Exactly. So if it's okay with you, I'd like to take your shoe off and perform a vascular assessment, neurological assessment, and a biomechanical assessment. If anything comes out, I'll do some further testing, okay?
Easy.
Beautiful. So Mark, based on all the assessments that I conducted, I was able to come to a possible diagnosis of hypothyroidism. But as I'm just a podiatrist, I can't diagnose this. But I'll tell you why I came to this result. So what I noticed is during your muscle test, there was weakness when you were trying to dorsiflex your foot, and I also noticed there was a lack of dorsiflexion in your gait when you were walking. This led me to believe that you suffered from a foot drop, and this could be due to the edema that you have in your leg, compressing on the perineal nerve possibly, causing some sort of impingement on the nerve, also known as nerve entrapment, and diminishing your dorsiflexion.
Yep.
What I also noticed is during your neurological assessment, the monofilament test and the Achilles reflex test showed me that there was diminished sensation and also reflex. That led me to believe that there was also damaged nerves from the edema.
Well, that sounds bad.
Nothing to worry about. You have a good team that's going to be on your side. Additionally, what can happen in severe cases of hypothyroidism is there can be some sort of heart disease or peripheral vascular disease. So that's why I did the toe brachial index. However, there doesn't seem to be too much damage to your left leg, although it was better on your right. So based on these findings, what I can do for you today is I'm going to prescribe you with a ankle foot orthosis and also exercises for your dorsiflexors. So what I would like to do with your left leg, if you could, it's going to be hard to begin with, but over time it may strengthen. Try and dorsiflex your leg in this motion as much as you can till you feel a fatigue, and repeat those repetitions 3 times a day until they become stronger. I'm going to finally also send you to a referral to your local GP who will actually be able to diagnose the problem. And finally, I'll have you back here in 6 weeks to assess any improvement.
Oh, sounds cool, mate.
Good to
And
hear.
that thing looks cool.
It is
Looking
cool.
forward to wearing it.
Well, I'm looking forward to see the improvements.
Easy.
Mark, come in. How you going? Come on through. So, how you going today, Mark?
Yeah, pretty good, not too bad.
That's the way.
Easy.
Yeah, the blood test I sent you for last week.
Yep, don't scare me too much.
That's all right. I have the results for you.
Yep.
So let's just have a quick look. I'm afraid you have hypothyroidism. So Mark, having been diagnosed with hypothyroidism, there's a couple of treatment options that you have. Now, as a GP, I'm entitled to prescribe you suitable medications for this condition. However, if in the event you were to take on board a different type of therapy, you would need to be in touch with an endocrinologist. Within my scope of practice, I can prescribe you methimazole, and basically methimazole is a drug that prohibits iodine intake through your thyroid glands. This is the medication. I need you to take this once a day for the next 6 weeks, and then we'll see how that goes. I won't see you again for the next 6 weeks. However, I will need you to see a podiatrist again to have the edema managed.
Alright, so Mark, how did you find the AFO and the ankle exercises?
Oh, bro, it was amazing. Swelling went down. Muscle weakness, starting to get yeah.
Have you noticed the...
Cramping, yeah, still there, but way less than before.
That's very good to hear. I'm just going to quickly do that muscle test we did last week. So you're going to try and push your foot towards you, and I'm going to try and resist it. I just want to assess the strength.
I've been doing the stretches, so just watch.
The strengthening exercise, alright, so try and lift your foot up towards you. You know what? It's actually gotten a lot better.
I'm telling you, mate. I'm telling you.
So
Yeah,
the
I'm
GP
not-
has given you a blood test, also given you medications, as I understand.
Yeah, gave me some
Spoken to
referrals
GP.
as well. Went to there.
Beautiful.
That's fine.
That's very, very good to hear. So from here, I will conduct a neurological assessment just to see how well the neurological status has gone.
Can you
That's
please go for it? Go for it.
We will do, but for now, I would also like you to continue with the ankle foot orthoses and the strengthening exercises.
Yeah, they're amazing. I can't walk on them, but it's good.
Beautiful.